Attach the 3 ECG leads to the patient, red and black on the left hip and white on the right shoulder. Press Start on the console to calibrate and record a baseline ECG from the skin. Set up sterile field per protocol and repeat skin prep.
Well, Jerry, I'm here today to propose to my girlfriend.
Can you see it on the camera screen?
Yeah, it's looking good.
Now, how long have you been going?
I've got such a good vein, I can probably use just the camera.
Gorgeous.
We kind of had some problems. And,
You okay? Okay, I got a little bit of numbing medicine coming your way.
Okay.
well,
Starts off a little tiny needle poke here. Poke and a burn. Burn there is the worst part.
Turned her family. And then I turned 21. Yep. And I started drinking and acting stupid and a fool.
It's a pretty vessel.
Before it. Because you were stupid. Yes. Alright. And so 3 or 4 months passed by, and it was the hardest 3 or 4 months of my life. Yeah. I was destroyed inside. I couldn't
Might
live
get a
without
little
her.
bit of pinch right here
And then
on the outer wall of that
a month
vein.
ago,
But
we ran into each other. Yeah. And she gave me another chance. Oh, she gave me another chance. Well, there you go. And I'm here to propose.
Access vessel and advance guide wire, release tourniquet, and insert the introducer. Open the sterile biosensor package and remove the protective plastic sleeve. Trim the PICC, load the biosensor into the PICC until the end of the biosensor protrudes slightly beyond the end of the trimmed PICC. Connect the Luer connection of the TUI Borst adapter to the hub of the PICC. Adjust the biosensor until 1 millimeter is extended beyond the distal end of the PICC and securely tighten the TUI Borst to prevent biosensor migration. Mark the biosensor with the sterile marking pen close to the TUI borst. Plug the connection end of the biosensor into the console and press start to perform a Doppler test. With the saline syringe attached to the side arm of the biosensor, inject several milliliters of saline. Once the image is captured on the Doppler screen, press stop to end the Doppler test
Hook up your
portion.
saline to that side arm,
Mm-hmm.
and then whenever you get it, I'll press start.
Okay.
And then if you'll just squirt it pretty good. Here's your flush. Yep. Now
Oh,
press
good.
stop. Alright, and you can just lock that saline column in there. That's on the right.
Wherever.
The PICC is advanced into the peel away.
Going?
Once the catheter tip has cleared the sheath and is in the bloodstream, press start on the console to begin navigation. The catheter is advanced slowly,
Okay.
observing the
Like 5.
sluggish Doppler flow of the
So
upper
you're out
arm
peel away,
initially.
right?
I think
Okay.
so.
Alright.
Okay. It is a 10 centimeter.
Yeah. So in the upper arm, you don't really see a whole lot.
Okay.
So this is about upper arm. Yeah, that's about what you'll see in upper arm.
As the catheter advances past the shoulder, the orange stop sign is encountered at the confluence and again upon meeting an area of resistance within the vessel. Once the catheter begins moving forward freely, an increased amplitude of Doppler flow occurs and drop into the SVC is detected by the Doppler signature.
More information.
Orange means that we're at the confluence probably because it flashed orange and then it turned back green. So the blood's coming in from different directions. You get a little bit of turbulence right there, so it should be making the turn or not. Does it feel like it's threading?
I'm bumping.
You're bumping? Yeah. Pretty much there. So you just okay. So you push by it.
I
That's
backed
good.
up
The
and
catheter is
bounced and
continued to
And then
be
it pushed on
advanced
by.
slowly
Yeah.
with a
So
continued
this
increase in
looks like
Doppler
SVC flow,
amplitude
so it looks like you've made
accompanied
the
by an
turn.
increase in P
So I
wave.
mean, I would be comfortable breaking my peel away at this point. We're even starting to get a little of a jump
I see a
in your
increase in
pee. Yeah, your pee's jumping a little bit.
Okay, so if I back up, we would actually lose that P. It should get smaller.
It should, and it is. Yep, there it goes.
And the
see, this
Doppler
is getting
changes
smaller.
time.
See?
That's cool.
Your amplitude as you get closer to the heart, the SVC as it gets bigger, you got more blood going through. So,
That's a 1 centimeter difference right there.
yeah, it's huge. I mean, it's huge. It's amazing what this machine will tell you. So, like I'm saying, this is real time, but like you'll
that's
see
right.
this,
You said
you'll
it
see
was
this turbulent flow before you ever see the bullseye. So, if you really know what you're looking for, you'll know the bullseye's coming before it even pops up.
Okay, I'm going to back up one more time because she said I was blocking it with my hand.
So you can even hear it.
Yeah.
It gets slower.
The catheter is slowly
Now, not
retracted
every
to
patient is a
monitor
great
the
patient
corresponding
with vertigo
changes
like
in the
we
Doppler
have.
amplitude.
So not every patient are you going to see those subtle, perfect differences, but
The catheter is re-advanced until it is impeded by the peel away, and the peel away is removed
Yeah,
with
and I'm
continued
talking over you.
advancement to the blue bullseye,
Keys jumping
which
again.
indicates the
Yep.
tip is at the CAJ.
Okay. Peel away? Everybody agree?
Yeah. Sometimes the peel away will constrict it because of that big fat hub. And you'll lose it for a minute like that. Oh, he's backed it out.
Yeah, I did. It came with it a little bit.
He's
Now we're
really
good.
jumping. There we go.
Now we're
And there's our
turning.
bowl. Yep.
Alright, now I'm going to take it a little further. That's a huge P wave.
Mm-hmm.
And we got all kinds of turbulence. P wave's matching QRS, isn't it?
Yeah, that's beautiful.
Why do I still have a target, the bullseye there?
Well,
There you are. Yeah.
So I
3
was under
heartbeats.
VH at that point. Now, probably a little earlier than that, do I want, right? You think?
Yeah, I mean, usually it takes about 3 heartbeats. So if you move it at all, wait those 3 heartbeats. If you're looking at this. If you're just reading this, then you're getting real time.
Did I tell you I was doing 2 more
You
than I
said
thought?
you added a generous 2, I think.
Right now, I'm at that 2 out.
Okay, so your measurement would have been perfect. That must have been, that was just luck.
Yeah,
The
I never
catheter
get
is
that way.
advanced beyond the blue bullseye symbol until
hear
the
that
orange
noise?
stop
That's the noise you
sign
want.
is displayed once the catheter tip has
we're
reached
actually
the
looking
right
at this
atrium.
really cool machine over here showing us your heartbeat on it. It tells us where we are with this catheter. It's really cool.
The catheter is then retracted several centimeters to the blue bullseye, or CHA, with a good turbulent Doppler signature
Technology
in
she's showing us here. I really appreciate you letting us check it out.
because I noticed it when I was using it on. If you just get that.
This is a pretty steady target.
No, that's perfect.
Okay.
Yeah. And I can freeze that. I want to wait till we get a full script. So we'll look good.
Hey there, it's Jim. Could I trouble you to order us up a stat portable
Press
chest
stop to
X-ray
freeze
for
the
PICC
screen
line?
and
Could I trouble
print
you to
or
order
hard
us up a
copy
stat
of the
portable chest
screenshot.
X-ray for PICC line?
So a lot of
Thank you,
times,
Bridget.
if we have an anal X-ray person, which you guys,
Really? Okay, I was going to say really where the bull's at. So I'm going to back up, what, 1 or 2?
just one, and wait a minute, wait 3 heartbeats, and then go another half and wait 3 heartbeats. It's getting more spiky, so you're, yeah, I was going to say, you're at
should be the top of the CAJ probably.
Yes.
And my 1.5 puts me probably deep CAJ.
Right.
All right.
Yep. But could you see the difference in the Doppler? See how I called the green before it ever popped up? Because it's more spiky. It's more distinct heartbeats that you're seeing, less of that.
Yeah, it's a little more chaotic.
Yeah. The chaotic is CAJ. But you see how important the Doppler is versus the P-wave? I mean, the P-wave.
Clean and dress the site per protocol. Remove and discard the biosensor, then cap and flush the PICC per protocol.